Ailsa, what is it?
Oh, you know who.
Have you upset her, Annie? Annie, I'm talking to you. She was all right before.
Don't you start blaming me for her. I haven't said a blooming thing.
Well, look, you haven't touched your tea.
Got no appetite.
Oh, why not?
You know why not.
Oh, Annie, the way you're going on, it isn't a torture chamber. It's therapy to do you good.
Well, why can't I do it in here then?
Well, because this isn't the place for it, and the day hospital is. They've got all the right equipment there. A lovely gym. There's a lovely light place with the windows low down for seeing out. And people, some new faces. Well, you go to the concert, don't you? You don't mind leaving the ward for that.
It's different.
No, it's not. It's the same place. 5 minutes down the corridor.
Why can't she go then?
Well, because Ailsa doesn't need to go, and the doctor thinks you do. Well, anyway, you go tomorrow and see how you get on, all right? Up we go. There you are. All right?
Yes, thank you.
Now you lie still, Mrs. Beresford, and try and get some rest, all right?
Thank you very much.
All right? Yeah. I wish they were all as light as that. Her bones are very brittle. Be very careful if you turn her.
Charlie, when is the thing?
I know.
Nurse?
Just a minute, Ailsa. We'll do Mrs. Honeyman next. And you should have seen that sore last week. Well, what is it, Ailsa?
Look, she's done it on the floor again.
Mrs. Taylor? Oh, no, look, it's all right. Now, come on, take your time. You can tell me. It's all right. Ailsa, did you empty this water on the floor?
Well, the flowers are incontinent.
Oh, Ailsa, you're impossible. You really are. I don't know what to do with you today.
Well, I don't know what to do with me today. I don't know what to do with me today.
Well, now, look, Annie won't go every day. Just 3 days a week, that's all. Now, look, you've upset Mrs. Taylor.
Well, I can't understand a word she says. It's double Dutch, well, now, isn't
Well,
it?
you shouldn't bully her.
Boo-hoo!
It's all right. I know, she upsets me too. But she's just bored, that's all. That's all right.
I wanted to stay with Annie.
I know you did, but
I've known
Ailsa, there you are.
You're looking for me, I suppose.
Yes, and it's nothing to be proud of. You know you shouldn't wander off.
I know my way about. I don't get lost.
Fine, well, please go back now.
Oh, meanie.
I'm sorry, she's always doing that.
Oh, it doesn't matter. She's probably lonely without her friend.
I don't know Ailsa. Given half a chance, she's off like a rocket. The porters are always bringing her back, and you just can't reason with her.
I think she just wanted to see her friend.
Yes. Well, if she does it again, just turf her out. I'll have to go and stop that row. They think we're on fire or something. Carry on, I'll be straight back. Annie! Have you gone bonkers? I can hear you up the other end of the ward. Now stop it.
Well, where's the porter then?
All right,
He's
Taylor.
late. I've been sitting on
Don't
my
worry,
BTM
only a
since
bell, and you'll
breakfast.
stop me.
I've got to go. I'm on the list. I'll see
You
my
are
name.
not to ring it, Annie.
I see my name. I'm on the
Well,
list.
10 minutes won't make much difference.
The lady says I've got to go today.
I know, and the porter knows. Now, no one's going to stop you going. Don't be daft.
Staff?
Yes, nurse, what is it?
It's Mrs. Beresford. I was trying to get her to turn. And her leg... Well, her leg, I think, is broken.
You stay there, I'll get the doctor.
This isn't a day.
I know, I'll fetch her. Annie, will you give that bell to me? I've told you I can't hear myself think.
She hurt me.
Don't be such a baby. It's not your bell anyway.
I know that.
It's a ward in the block just across the way. Your mother is still a little shocked, but I think you'll find that she's comfortable.
I don't believe it. We came last week and she was right as rain.
Well, it's a pathological fracture. It could have happened at any time.
Are you telling us a bone just breaks? Out the blue?
Her bones are very brittle. She does have a condition of the bone that...
Helped on by you, no doubt.
It's a hard thing to grasp, you know.
I know what goes on here. Somebody push her, did they? Someone give her a little shove?
There was no fall involved. There was no question of a fall. Your mother was in bed when the accident happened.
Oh, you do admit it was an accident.
Well, of course it was.
But no one was to blame. No nurse was within a mile of her.
I didn't say that.
No.
I will say this, Mrs. Noonan. We are always very careful with your mother just because we know the risks involved.
Risks? I know the risks of having her in this place.
She lost her glasses twice, you know, being moved from ward to ward.
Well, yes, I'm afraid things like that do happen.
And what about ill treatment? What happens when they get on your nerves? What happens when they're being dim? What happens when they're being slow?
I'm not sure what you're saying.
It's been a shock
I'm
to her.
saying
you know.
I'm not satisfied. You haven't satisfied me how it happened.
Well, I'm sorry, Mrs. Noonan. But if you're so worried about your mother, what I suggest you do is go and see her.
You think I haven't got her at all? You think I don't care how she is? Think like this is all right.
The nurse is right, though,
Oh,
Moira.
yes, get rid of us. We're asking awkward questions. We're making her embarrassed.
We have nothing to hide. If you wish to complain, all well and good. It will be investigated.
I will complain. I owe it to my mother. I wouldn't be a daughter if I didn't. You see, I know the strains. I know myself how things build up. I know what drives you to it.
Who do we write to, then?
You write to the senior nursing officer.
Thank you. Come on.
Hello. Sorry to bother you. It's Mrs. Whipps in the day hospital. She's pestering the life out of me. She says you've got her bell.
Yes, it's in the kitchen. Take it.
She seems upset about it. Well, she says you snatched it from her. I think she's saying you were, well, rougher than you need to
All
be.
right, let her complain. Why not? In for a penny, in for a pound.
I'm sorry, I don't understand.
Well, why should you? What happens on this ward is my business.
Yes, but Annie's my patient
Just
too,
take
and
the bell and go, please.
Sticks and stones may break my bones. I won't eat processed food. I can't. You shouldn't feed Doris.
Why not, Ailsa?
But the nurses in the day hospital don't feed the patients. My friend Annie told me. They make them feed themselves.
Doris can't feed herself.
The nurses in the day hospital are much cleverer. They don't have accidents.
Come on, Doris. Did you find the bell all right?
Yes, it was in the kitchen like you said. After all that, you didn't really want it.
Yes, well, that's typical.
I came at a bad time, I think. Sorry.
Well, it was a bad time, actually. This patient has a broken leg, and the relatives were trying to make out that I'd done it. So when you turned up and came up with another accusation...
Oh, I see. I am sorry.
It's all right. There are lots of strains on the ward, you know. This place is a different cup of tea entirely.
I wish more of the patients could live at home. Relatives you were talking about, maybe they feel guilty because they don't have the old lady at home.
Oh, that doesn't excuse the way they went on.
No, but it might explain it. Although you do get people who just can't cope. I was reading some time ago that when you get battered babies, you can have old people battered too. By relatives, I mean, at home.
Yes, but certainly not by nurses.
Well, it does happen, though. Not here, I mean, but I've heard it does. Sometimes in mental hospitals, when nurses have too much to do and conditions are bad.
But those sort of nurses get weeded out. Well, it's in the management's interest. It's their heads that are going to roll. Since that Whittingham business, they can't afford the scandal.
You say those sort of nurses as if they're freaks. But I don't know. The other day, one of the nurses was off sick. There were so many in and we were rushed off our feet. One of the patients, she was really playing up, upsetting all the others. And I felt I could have hit her. I really shouted at her.
It's funny. The woman who was going on at me, the daughter, she did say something odd. About knowing what drives you to it.
I could feel wicked things. I know I could.
I wasn't here then, no.
Well, 6 months ago, when Mrs. Beresford was first admitted, she came in with a broken wrist. There'd been a history of minor accidents, and the Noonan said she'd had a fall. But the social worker seems to think it's possible she may have been pushed and put out a hand to stop herself.
Oh, I see.
And it might explain some of the fuss, but not all of it. They say you were rude to them.
No, I don't think I was rude.
Well, I quote. The nurse with the glasses said if I was so worried about my mother, why didn't I clear out and go and see her?
I didn't say clear out.
Was that the gist of it?
Well, yes. I told them all I could. I said she had a pathological fracture.
Do you think they'd the faintest idea what that means?
I don't know.
Well, think about it. A nurse bandies long words about. No wonder relatives get in a flap.
Well, you don't know their attitude to me.
It's obvious from the letter. They accused you of negligence.
Worse than that.
You didn't handle them, did you? Didn't calm them down. You didn't pacify them.
Well, no. But it was so unfair. I wasn't even there at the time.
Where were you?
I was in the day room. A patient was making a noise with a bell.
What sort of bell?
Handbell. One of those old-fashioned sort of handbells.
No, that would hardly wake the dead.
Well, it was quite loud. I thought it was.
But were you justified in waltzing off and leaving Nurse Evans on her own to cope with turning a patient?
I didn't know she'd try and turn her. Anyway, she'll never learn if I'm always there. I can't always be there.
How long before the doctor arrived?
There were 2 doctors round her bed within 10 minutes.
OK, that's it. You can send in Nurse Evans.
Thank you.
And staff. Not only would I give them bells, I'd give them tambourines, castanets, the lot. I'd let them raise the bloody roof.
Yes. But the bell was disturbing the other patients.
How?
Disturbing them.
What exactly do you mean by that? You mean somebody actually got up off their backside and stopped acting like a dummy?
Well, the lady who was ringing the bell, I'd told her twice already.
Ah! You mean she'd actually got the message? She only had to ring and you'd come running?
I should have ignored her more, you mean?
Look, Stuff, just use your loaf. And next time you have to deal with relatives, keep your temper. All this takes time.
Yes. I'm sorry. He wants you now. What's he like? All right, I suppose. He didn't seem to like me much.
Oh. You've got a complex, you have. He's got his job to do. Cross your fingers.
That you're doing?
Well, I was asked if we wanted it, and yes, I said we did.
You're learning.
I couldn't get the tambourines or the castanets.
Right, nurse. Don't get it wrong.